In this video, I'm going to be talking about treatments for sleep, specifically looking at medications that have often been suggested for improving or at least getting to sleep. As a first primer, sleep medications do disturb the cycles, the REM and the NREM cycles, which I cover in another video. And so it must be said at the outset that there is no definitive sleep medication that is guaranteed and safe to work in the long term. Now, the next part is what are the most common drugs that are used. Now, in the UK, amitriptyline, which is an older tricyclic antidepressant, is often given for sleep in the first place. It's a low dose that is often given just once a day, and I recommend my patients to take it around 6:30 to 7 in the evening. That way then, if you do get drowsiness and it improves sleep, at least you can get a good night's sleep and you don't wake up with too much of a hangover. Amitriptyline is a relatively safe drug. There are some groups of patients, those who have irregular heart rates and some other conditions where it may not be advisable, and certainly I would not advise it in the elderly age group, but it does make a difference in improving your sleep, and the drowsiness it gives can at least improve the sleep quality as well. In the long run, however, it does reduce the NREM phase of sleep, so it's not recommended in the long term. Now, the second type of drugs is what's called Zopiclone or Zolpidem. These are again drugs that are quite useful in acute insomnia. So for people who are having jet lag, for people who are having acute stress related reasons for loss of sleep, then that would be a good reason to give them a 3 to 5 day dose of Zopiclone or Zolpidem. However, again, these drugs have been found to have a dependence-inducing property, so our primary care physicians and even secondary care specialists don't like to give it in the long term. So I would suggest 3 to 5 day trials at best. They can cause a rebound insomnia, so when you stop them, you might again have some sleeplessness, but that is why medications in general are not a preferred option by itself. The third group, the third drug which is often suggested for sleep, is called melatonin. Now, as far as the UK is concerned, melatonin is not for regular prescription by primary care or secondary care. It can be given in certain age groups. So for example, in elderly people where melatonin gradually decreases, it's becoming popular, but still GPs cannot and do not usually prescribe it. For the younger age group, for children and for adolescents, there is a license to prescribe it, but not for adults. The reason I say it is that it is an inexpensive drug. It is available quite often in other countries, but in the UK, there is a restriction for the time being. Now, the way to think about melatonin is that it's not a sleep-inducing drug. Imagine a race, and melatonin is actually the starter gun for a race. It's not the one that's going to get you to sleep. It sets the conditions in place so that you can then do the other activities that eventually bring about sleep. The whole purpose of all of this is we have to understand that in a lot of sleep disturbance, it's often a hypersensitive nervous system that you are trying to control. So if you can come up with other ways to calm the nervous system down, you can then use medications as a gentle aid. Thank you.